Hi, Tracy.
Oh, hi. Wait, can you see me? Can you
Yes,
see
yes,
me?
yes.
Yeah, okay. I cannot see myself. Wait. Um,
Yes, we can see you clearly.
okay. Can hear me, right? But okay, right?
Yes, yes.
Okay. Um,
We'll wait for more participants to come in, then we'll start soon.
yeah, sure, sure,
Okay.
sure. I gotta figure out how I see myself.
Okay.
Blur my background. Kamu?
Hi, Tracy.
Yeah, hi.
Hi, everyone. We'll start soon, but we'll wait for a few minutes to more participants to come in, yeah?
Okay.
Hi everyone.
Hello.
I'm gonna start now. Good morning, everyone. My name is Vanessa Iya, and I will be your host for this morning's webinar. Welcome to today's webinar on growth on non-clinical nursing careers. I'm Vanessa, and I will be your host for this informative session. During today's webinar, we will be exploring on our topic, which is growth on non-clinical nursing career, which is a part of our nursing management course in our nursing program in Unimas. I'm sorry, we have some technical problems with the
No worries.
Okay. Uh, it seems that none, some participants cannot enter the Zoom, so because of some technical problem. However, are we okay to proceed?
Yeah, sure, no problem.
Okay,
If it's
okay.
okay.
Okay, like I said just now, our webinar today is a part of our nursing management course in nursing program in Unimax. So before we dive into today's webinar, I'd like to take a moment to express our gratitude to Mrs. Tracy, Madam Dayang, Dr. Chan, and Ms. Variante, our assessors for today, and all of you for carving out time in your busy schedules to join us today. To start off, I would like to humbly invite Madam Dayang, our head of department
Tutukkan
Tracy
sekarang jadi ngalan
at
itu
Unimas, and also our course
Pauline.
coordinator
Ngalan
for
itu.
nursing management to give a few words.
Kasi peng kayo
Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to everyone in the webinar today, especially our respected speaker, Miss Tracy.
Hi, good
Um,
morning.
Hi. Right. So to start things off, initially, this assessment is a very good platform for our student nurses to reach out to the community and to those who have made an effort to place a stand in the community, to be a voice in the community out there. And for your nursing professional development and your nursing knowledge on how you can expand your profession and how you can actually divert from your profession in this sense. Okay, I've always told early entry students that nursing is not just mainly in the hospitals; it's out there, and whatever skills you actually go through in the 4 years of your program actually helps you pave a way in the coming careers, be it nursing or even non-nursing. We've got a lot of people out there who are also not just like Miss Tracy, who are actually not in nursing itself or having a side passion which is non-nursing related. Even have an ex-colleague, a junior from nursing school, who actually does a business with eco-friendly straws, who is also a dialysis nurse, and also goes, does belly dancing and things like that. So, without further ado, I think I will leave the floor, because time is catching up with us today. We'll leave the floor to Vanessa and Miss Tracy to carry out the webinar. Thank you.
Thank you.
Okay, thank you, Madam Dayang. Now, without further ado, it's my pleasure to introduce our speaker for today, Mrs. Tracy, or I believe most of you know her by the name Tessie Peng, which you might have seen her across social medias. Mrs. Tracy Jantom has over 10 years of experience in nursing and are now pursuing entrepreneurship and also a digital creator that works with multiple local and overseas brands. She got her diploma in nursing from University Malaya, her Bachelor of Nursing with honors from King's College London, and an advanced diploma in medical surgical nursing. She spent a couple months at Pantai Hospital Kuala Lumpur as a critical care junior staff nurse before working at Kute Wat Hospital Singapore for more than 7 years in infectious disease department, and also took a role as a clinical instructor for nursing students. Today, she will be sharing her experience and insights on growth in non-clinical nursing career. Please join me in welcoming Tracy to our virtual stage.
Hello. Good morning, everyone. I can start now, right?
Morning.
Okay. Okay, I believe, sorry, first of all, good morning to everyone here, the committee, and I am very, very honored to be speaking to you all today. I believe this is my second time to speak to UNIMA students. My first time is also a webinar. That was two years ago, 2022. I was still in Singapore as a nurse. That was, I don't know what batch that was, but yeah. So I kind of forgot. It was 2 years ago, but I'm so honored to be speaking to you all today again, to UNIMA students. I believe UNIMAS and I are very close friends by now. Thank you so much for thinking of me. So today our topic, I've been given this topic, the growth in non-clinical nursing careers. And yeah, as you all know, I'm not too sure all of you know lah, but I have resigned from nursing 2 months ago. Not from nursing completely, but from my previous workplace 2 years ago, 2 months ago. Yeah, 2 months ago. Okay, next slide, please. Thank you. So today, we'll see what are the things that we're going to cover today. We're going to talk about, firstly, of course, introduction, understanding of the transition and the growth of non-clinical nursing career. Second is about me, my study and work experiences in nursing profession. Number 3 is my turning point, which is changing profession from being a nurse to a non-clinical profession. Number 4 is my story in how changing profession changed my life. 5th, challenges that I face in changing to a non-clinical profession. And then we're going to talk about skills and training, also useful for nurses to go in any field of career. 8, exploring career options using the skills and educations that you have. And lastly, I'm going to talk about my experiences and stories inspire from other people who also undergo transitioning from a clinical nurse to a non-clinical career. Okay, next slide. Next slide, please. Okay, introduction. Okay, so we go to the boring stuff first. So, transition and growth of non-clinical nursing. A non-clinical nursing career refers to a career path in nursing that does not involve direct patient care, but focuses on roles such as research, education, leadership, or administration within the healthcare system. So in simpler words, nursing that do not do bedside lah. Okay, like me, I don't do bedside anymore. I've been doing bedside for 10 years, but now I'm not doing bedside anymore. I'm still a nurse according to my license lah, but haven't expired yet. So I'm still a nurse, but I do not practice bedside anymore. So nurses pursuing non-clinical careers may work in areas like academia, healthcare management, policy development, or quality improvement initiatives, or any other things like me. I work in digital creation. So today we're going to talk more in depth about nursing outside of bedside. Yeah, what kind of career that you can choose other than bedside nursing. Okay, next slide. Thank you. So about me, that picture was last year. Okay, that's my only nice nursing picture. Anyways, me, I'm Tracy. Some of you know me as Stacy Peng lah. Okay, I believe that's how you can invite me to this because of that. Okay, I have over 10 years of experience in nursing. So I am now currently pursuing entrepreneurship and also a digital creator that works with multiple local and overseas brands. So right after I resigned 2 months ago, I didn't start my business. I started 2 years ago, actually, the business, but it was on and off kind of thing. But now I started pursuing it further, full time. And also, I work as a digital creator for social medias lah. I actually, it is like I just resigned 2 months ago. So I actually have a lot of upcoming projects for until the end of the year. So I can't really like show you what I've been working on. Yeah, but I am now currently pursuing my business full time and also creating contents for social medias. I'm also doing talks, which is right now I'm doing talks for students. I'm also doing some talks for other universities as well, but that will be in the later time. Okay, thank you so much. So my education background in 2013 until 2016 under scholarship of Yayasan Sarawak, I went into University Malaya and took diploma in nursing. And then in 2019, I was already working at that time, so I took part-time degree in King's College London. And then in 2021, my previous hospital sponsored me to go for advanced diploma in medical and surgical nursing lah. In Malaysia, I believe it's called post basic. Yeah. In Singapore, we call it advanced diploma lah. So I was under Nanyang Polytechnic Singapore at that time. Okay, next slide. My career journey. In September 2016, I finished my LM in early September 2016. At the end of September 2016, I started working already. So I went to ICU in Pantai Hospital Kuala Lumpur as a fresh grad. And then I stopped in December 2016 because I had an offer from Singapore hospital at that time. And I decided to take up that offer lah. So I went off to Singapore in December 2016 too. Okay, next slide. In December 2016 until recently, February 2024, I didn't put the hospital name here. I was under Yishun Health, which is Khoo Teck Puat Hospital. So in 2016, when I first joined, I was only a staff nurse. So in Singapore, before you get to be a staff nurse, you need to be in probation. I believe if you have more than 5 years working experience, you only need to be in probation for 3 months. But if you don't have more than 5 years working experience, you're going to be placed in 6 months probation, which I was placed in 6 months probation first before I was confirmed to be a staff nurse lah. Then in 2020, my manager decided to give me the title of clinical instructor because we had so much students coming to our department. And in 2020 to 2024, I got promoted into being senior staff nurse lah. So if you became a senior staff nurse, there's a lot of roles that you need to take up lah. A lot of administrative role in addition to having a bedside role as well. So in Singapore, I work in infectious disease department, which also house any unexpected pandemic. And I specialize in dealing with all infectious diseases such as MRSA, MDRO, tuberculosis, VRE. I believe you all know what it is already, right? I think, yeah. Okay, so in order to specialize in infectious disease, you also need to be an infection control nurse. So in the whole hospital, our department specializes in infection control. So back in 2020, when COVID hits, we were the first department to receive COVID patient in Singapore, the first COVID patient, and we were also the one that deal with the first COVID death in Singapore at that time. So everything was us at that time. So yeah, and I was also a clinical instructor for students posted to the department lah. So mostly what I did in Singapore after 2020 is teaching and teaching and teaching. Okay, in addition to also having bedside role, I was also teaching students at the side. Yeah, okay. Next slide. So turning point on changing profession from being a bedside nurse to something that is completely different. Yeah, there's a lot of factors that made me want to go from bedside nurse to something else, something that's completely not bedside. Okay, by the way, that's the cake my colleagues gave me. Congrats on your fun employment. It was so cute. And that's me in my farewell party. Okay, why did I want to change from a bedside nurse? Like completely resign from nursing. Okay, next slide. I got married. Yeah. Okay. Not that I'm saying that I got married because I got married, that's why I resigned. Not really. By the way, that's not me. That's a picture I found on Pinterest. But it's so funny. And I got married. So I think whoever that's married here, I'm not too sure who's married here. Whoever that's married here know that marriage comes into a lot of your decision making. So one factor being is, yeah, I got married, and since I'm working far away in Singapore, I have to rethink my decision whether I want to be far away from my family, because yeah, of course, when you get married, you want to start a family and everything. So yeah, that really comes into my decision making as well. Next slide. And also, it all started with, you all know, I think most of you know lah. Most of you know me from TikTok. So actually my first ever viral video, which is in 2020, early 2020. So this is actually my actual turning point. That video like went viral all over Singapore, all over Malaysia. And ever since that, that was me showing my frontliner life, something like that. I didn't expect it to go viral and everything. And after that video went viral, I went to making more vlogs and more vlogs, more stories, more how to say, more stories, more sharing lah in my social media. And I guess like some of you find it really inspiring, motivating for you. And I feel like I want to continue doing that. And that was the reason why I started my business in the first place, because I wanted to also inspire and also motivate people who want to go through the same path as me, okay? Especially nurses lah. And next slide. Okay, this was me. This was last year Singapore Nurses Day article. So they chose me to represent acute setting. So over there, I talk about TikTok is how I learned to edit my videos in creative way, and I think I bring that into work by expressing myself in the same ways to make the workplace fun and warm, which is true. Ever since I create TikTok videos, I kind of have this like creative ways in editing my video, but also in my workplace, I also learn to express myself in more creative ways with my patients, which is quite a very entertaining thing to do when you're working. And for me, at one point last year, I kind of think, what if I want to do this full time, which is inspiring people, which is motivating people, which is talking more to students, talking more to nurses, but I couldn't do it because I was stuck with, my full-time job. It was really busy. I was really busy last year because, like I said, as you become a senior staff nurse, you take more roles, administrative roles, bedside roles, everything you're doing. So I didn't really able to create contents that can inspire, that can make me be in touch with students, with nurses out there. As much as I wanted to answer everyone's questions, I couldn't really do it. So I guess by like resigning, I get to do this full time. I get to be in touch with more people and get to speak to more people. And if they need my help, I can help them more. Okay, next slide. Stories, how changing profession changed my life. So of course, I resigned 2 months ago, meaning I the feeling of after you resigning, it was really like, it's a mixed feeling, but it totally changed my life lah. Next slide. So I spend more time with my family and friends more now. Not to say that I didn't spend time with them for the last 10 years, but it was quite limited because what can I say? Clinical nursing, there's kind of like you spend more time in the hospital compared to like with your families. You spend more time with your patients more than your family. To be honest, because I work in Singapore, so I didn't really have much time with my family, my friends. And furthermore, now like I got married last year. Now I get to spend more time with my husband, something like that. So it's kind of nice, a nice feeling. Suddenly, like if my family say I want to meet you today, I can meet them. My friends say let's go out today, I can go out. It's normally for the last 10 years, they have to make like appointment to meet me. Just kidding. Like so I just spend more time with family and friends lah. Next slide. And I've discovered my passion in the creative industry. So I started my brand last 2 years actually. It was actually inspired by my social media presence lah actually. A lot of people came to me and say like, oh, how can I be like confident as you? How can I be productive as you? How can I not listen to people, bad mouthing me, something like that. So I kind of like started a brand that also serves as a community where everyone can go there and that can be a safe space. Excuse me. So I started learning how to, I think some of you know that I recently sell my tote bag. So I started my sewing journey. I started designing things. I started like, making words. Yeah, I started a lot. I started being creative a lot. And so I've discovered my passion in the creative industry now lah. Next. Challenges. Okay, so we come to challenges. Challenges that I face changing to a non-clinical profession lah. Next slide. So financial. I don't really put much there. I just put financial. You all know that financial is a very important aspect when it comes to resigning. So my advice is do not ever resign without any financial plan beforehand. That is it is nice to like leave the bedside and not think much about the job anymore, but you also need to think about your financial. So for the first few weeks, I kind of got scared to like resign because I'm afraid what's gonna happen to me, what's gonna happen to my family. I was actually the sole breadwinner before this. I was I kind of had a lot of, I was the one, because working in Singapore, of course, you earn more. So you kind of be like at the top of your family, even though I'm the youngest. I kind of was at the top at that time. And then now I'm no longer a nurse. And so thankfully beforehand, I did plan my financial well enough. But there comes a time where you felt like you were too afraid to spend, because you're thinking like, oh, your salary is not like last time already. Every month you get your salary. Last time, now you don't get already. You need to find ways to find money already. Something like that. Oh yeah. Next slide. And insecurities. I cannot stress enough. I struggled with this for like on and off. I struggled with this. After resigning, I felt like I don't have any. I have a lot of self-doubt of myself. I had a lot of fear. I have a lot of anxieties after that, because for the past 10 years, I've been a nurse. I know what I am. Like when people ask me, what are you? I'm a nurse. Okay. But now I'm like, what are you? I don't know. Something like that. And then if like past 10 years, people look up to me, students look up to me, they would say CI, thank you so much. So that kind of give you value, right, in your life. But now you're just at home alone, and you're just like click 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 click. So it's like it kind of plays a lot into your mind. So yeah, I started a lot of insecurities, which I'm still currently working on it. I have a lot of upcoming projects, so I'm kind of keeping myself busy with all these projects. And I believe that if some of you wouldn't want to go to bedside nursing, you better find something to do that can fulfill your mind and everything, so that you don't really sit in a closed room and like thinking. Yeah, okay, so next slide. Okay, supports, people that support me when in decision making for changing profession. Of course, my husband and also my family. My husband supported me all the way. I asked him if I could resign from nursing, because we just recently got married. And so, of course, he's going to be the only sole breadwinner. But I asked him like whether it's okay for me to resign, for us to further start a family on our own. Then he said, yeah, it's fine. Do whatever you want. And also my family, I really thought my mother would be against it, but apparently she is more excited for my journey ahead lah. So I'm kind of grateful for that. Next slide. And most important people were my colleagues. They were really the ones that support me actually. I miss them so much. Actually, my previous workplace, I work with actually good people. I know it's a blessing to work with people who are really good actually. I was really grateful for them. So number one rule, you do not tell your colleague you want to resign, okay? Do not. But I did confide in one of my colleagues, and I said, actually, I want to resign. I feel like I've been feeling burned out, and I think I wanna, stop for a while and just continue my business, continue my content creating. And she said, go for it, And when I resigned last 2 months in that farewell party, they told me that we're sad that you're going, but we are so happy and excited for your journey. And I feel like that really like shows how good of a people they are, and I have a lot of supports along the way lah. So yeah, next slide. And also, of course, my followers. I actually read all my messages, just that I don't know which one to reply. I'm so overwhelmed, but I do actually read some of my messages sometimes. And a lot of you have sent me so many messages that made me cry. And I feel like I could do this so much better, this journey after nursing so much better, because of my followers. And some of them even saw me like before, like when I was single until I got married, so when I first posted my video until now, they were still with me, and I'm truly eternally grateful for that, and I think that really makes this journey even more exciting. So yeah, thank you so much. Next slide. Skills and training. So before going into any desired fields of your career, new nurses should know that they have to believe in themselves and their capabilities. So I wrote there, just because you are not good in certain things does not mean you are not good in something else, which is true. In my 10 years of nursing, okay, there's a lot of different kind of nurses. So when it's good to discover while you're a student now, it's very good to discover what you really want to do, because you all have the privilege to go to different kind of departments, right? When you go for posting, you go for cardio, you go for ICU, and neuro, kids, and you should really take the opportunity to learn there and ask yourself, do I really want to do this, or do I want to do this? Like, do you want to do pediatrics or you want to do geriatrics? Am I good with your geriatrics or am I good with babies more? You have to really know what you're good at. And that is why I keep on saying students' time are the best time to learn, really, because you get to go to different departments, but when you start working, you don't get to do that. You just work in your own department. So from now on, just take note of what you are good at lah. Okay. So for example, never stop learning. For me, how I can survive in Singapore is I never stop learning. That's it, I think. Because if you stop learning, your mind is empty, or you have no soul to go to work. So for me, never stop learning. Just learn whatever you can, especially things that are important in your department. Learn it as much as you can. That's how you can, go on with this nursing journey. Because I'm gonna tell you now, 10 years of nursing, I I can count how many days that are good. To be honest, it was really a struggle. So start from now on, try to know what you are good at. For example, if you go to your pediatrics posting, ask yourself, do I want to work with babies? Yeah. When I was in my pediatric posting during my student times, I already know on my first day, I do not want to work with babies. No, I do not want to stick needles to their tiny hands. No. But yeah, I'm good with geriatrics. I'm not good with pediatrics. Okay. Next slide. Exploring. So some people go into nursing school already knowing exactly what it is they want to do. They've dreamed of taking care of babies their entire lives, or being there for the geriatric population as they take their last breath. But for others, the decision is not as easy. I know for me, I went into nursing school completely clueless as what it was that I wanted to do for the rest of my life. I struggled through school as one semester passed, then the next, never feeling called to a specialty. So next slide. So first of all, I want to say you're allowed to change your mind, okay? For starters, you have to realize that you are not married to the specialty you choose to go into. So while it's an important decision, it isn't life and death, and you are allowed to change your mind. I think knowing this can take the pressure off and allow you to enjoy learning about multiple specialties in school. So for example, right, when you go to work, they put you in a specific department. And then 1-2 months, you don't feel like being in that department. You can always raise your concern to your manager. Just tell them, I don't think I can work well in pediatrics. I want to work in geriatrics. I'm pretty sure they will just say, okay, let's see where we can place you. Okay, next slide. Ask for the experiences you want to have. So sometimes in life, you need to ask for the experiences that you want to have. So don't expect that your lecturers know where to place you or even have your best interest at heart. So if you know that you like critical care settings, request more than one day of learning about the emergency, ICU, NICU, PICU. If you don't know exactly what experience it is that you want to have, you need to experience everything. So even if your curriculum, I don't know if your syllabus can allow, if it doesn't allow for a day in the emergency, pull your lecturers aside and request one, even if it's for a couple of hours. Try your hardest to visit every floor in the hospital so that you start to realize what it is that you do and do not like. To be honest, when I was a student, my posting was at Hospital Kuala Lumpur, which is the busiest hospital in the whole of Malaysia. And I get to experience every 2 weeks there, right? So every 2 weeks in a department, every semester. No, every month, every semester, I get to experience different departments. So I did not know what I wanted to do that last time. I wanted to do emergency. I kind of like emergency at that time. You know, I like the hustle, I like the bustle and stuff. And I kind of request like one day I really want, not just from my lecturer, but from the staff nurse there also. I kind of asked them, oh, what's this, what's that, what's this, what's that. I was that annoying student. I keep on asking questions from staff nurse last time. So I prefer you guys to be that way so that you know more what you really want to do in the future lah. Next slide. Write down your feelings. So this one important. This one my way lah, but if your way, different way, you can do your way. But as you go through nursing school, continually write down your feelings at the end of each day. I really think keeping a journal is very good. Okay, even if it seems trivial, write down your feelings after you leave a unit at the end of the day, after you're done in the unit lah. Maybe you look back and realize that everything you've written down can affect you. So, or maybe you look back and think, wow, I didn't realize how much I was enjoying myself. So, for example, after you're posted to pediatrics, you just keep one journal and say, I love pediatrics. I love how I can stick needles to babies, something like that. So write down your feelings. You can, after your graduation, you can look back and you say, oh, I really love pediatrics. Maybe I should go into pediatrics, something like that. Next. As you master your skills, keep track of whether or not you enjoy them. Okay, make a list of whether or not you like doing that skill. You change a diaper on an adult. Did you enjoy that? Or would you rather change a diaper on babies? Okay, yeah. So you learn how to start an IV. Do you want to work in a unit where the patient need IVs or not? For example, cancer unit, oncology department. Do you like, because you need to keep on poking needles for cancer patients. So do you like to poke needles? If you like, then go ahead. If you don't like, don't lah. Okay, so yeah, you try to analyze yourself that way. Next slide. Ask yourself these questions. Next slide. Okay, do you prefer working with pediatric patients or adults? Maybe you can screenshot this and ask yourself after this. Do you enjoy forming long-lasting relationships with your patients? If so, then you will want to work on a floor where patients stick around longer than a few days. Do you prefer caring for incredibly sick people? If yes, perhaps you want to work in an ICU setting. Do you like to focus on one body system? If so, maybe you work on a neuro floor, cardiac floor, or another specialty floor dedicated to one body system. Do you like working in the hospital? Maybe not, and a clinic job is better for you. You could work at a pediatric clinic, psychiatry office, or even get into aesthetics. So yeah, maybe this whole thing you can screenshot and try to ask yourself more after this. Okay, next slide. Okay, this is my last slide. So these are my experiences and stories, people that have inspired me to go from clinical to non-clinical. So this is Auntie Lillian. I'm sorry, I don't have nice picture of her. She didn't want to give me also. This Auntie Lillian, she used to be a nurse. She used to be a government nurse in Miri. Yeah. She worked in Klinik Kesehatan Ibu dan Anak. And she worked a lot with mothers and babies, of course. So she went at one point, because she's actually my natural family planning teacher, because before you go into marriage, you need to go for that course. So she was that teacher at that time. So she told me that when she was a government nurse at that time, because you need to have like, you need to teach family planning, you need to teach family planning with, using contraceptives like condoms, pills, and for her, because she is a Catholic, she's a Christian, she kind of think that kind of like, bercangga, how do you say that? Yeah, like contradict with her belief, because in Christianity, I do believe that we don't use contraceptives. We believe in more of a natural family planning. So for her, she decided to resign because of that. And now she's moving on to teach newly married couples about natural family planning. So she's using her specialty. She doesn't really completely abandon herself as a nurse, but she kind of transformed that into teaching people about natural family planning. And then for this Theodore John was is actually my friend. He's older than me lah, but he's like 5 years senior, and he was actually working in what do you call that blue hospital, Columbia. Yeah, Columbia Hospital in Kuala Lumpur. And he was working there for 10 years. He was working there for 10 years until he decided to be an offshore medic. Yeah. And at that time, because I was still in nursing school, when I heard his stories, I kind of like, you can be an offshore nurse? He said, yeah, I can. Like, I don't think I want to be in a one place for 10 years, he said. So I'm going into a different direction lah. And I'm like, wow, okay. So that's when I kind of know at that time, that kind of opened my eyes, oh, that you can actually be another kind of nurse other than bedside nurse. So yeah, he kind of really inspired me at that time. And then last one is Angel Su. Angel Su was my preceptor. When I first came to Singapore, she was the first person that I saw in that department, and she was my preceptor. And I think I am very blessed because I had a very good preceptor. I'm pretty sure not everybody can have a very good preceptor. Some people have like multiple scary stories about their preceptor, but I did not, because Angel was kind of like a friend to me. She taught me a lot of things, but she was also a friend to me. But on my second year there, she decided to resign because she wanted to go back to Cebu. Yeah, she orang Cebu lah. So she decided to go back to Cebu to spend more time with her family. Because she had 2 kids at that time. So she wanted to spend more time with her family initially, but of course, like every other nurse, she cannot really truly abandon nursing. So she went to Petronas, if I'm not mistaken. She went to Petronas and be the like some kind of medic there. I'm not too sure the position, but she went there and she had so much fun there. She told me that like if you ever like feeling burned out from bedside nursing, you can actually join Petronas, because Petronas is very big in Sarawak, right? So like they're taking more nurses actually. And then she actually inspired me to actually look at offshore nurses. But sadly, I don't think I can be an offshore nurse because I don't know how to swim. But that really opens up my eyes that you can actually do nursing in something else, not just bedside. So these 3 were my role models back then, especially Auntie Lydian, because I don't think people can resign from government nursing. Yeah, it's quite an impossible thing to do, but because she believed in herself that she kind of like resigned from being a government nurse and chose a career path that is aligned with her faith, but also making her truly happy until now. So imagine she's like 60 something years old now. She resigned when she was 30 something. So it's been like 30 years for her. So I kind of believe that when you do something that you like, you're gonna be happy, even though it wasn't something that you planned to do beforehand. So yeah, these three were mine. So yeah, thank you so much. So do I read the questions that you gave me or? I'm so sorry. I think I took so long to talk, right? Yeah, we're ready for Q&A.
Hey Tracy.
Hi, yeah.
I have some few questions.
Yeah, sure.
So before that, I want to say thank you for attending. Thank you for being our speaker. And I'm actually one of your followers in TikTok, and I guess in those people inside the Zoom meeting are also your followers. So I want to present them that you are very inspiring for all of us. So keep doing what you want to do and what makes you happy.
Hmm.
So
Thank
the
you.
questions that were given was so what makes you become interested into pursuing entrepreneurship and engage as digital creator?
Okay. What makes me think of pursuing entrepreneurship is because at first I didn't really think I was a businesswoman. I didn't think so. Like me, a businesswoman, I cannot really see that. But like I said, my turning point was when I started TikTok and I started getting viral. That's when I started getting a lot of messages. I I think the message that really impacted me was somebody told me that they went to Singapore because of me. And then after that, a few more people messaged me also. I went to Singapore because of you. I went to work in Singapore because of you. I didn't know that we can work in Singapore. Something like that. And I came on thinking, wow, I kind of have to be careful with all my actions from now on because a lot of people are watching me. But then I feel like oh, if a lot more people are watching me and get inspired by what I do, why not I start a brand that can be a safe space for every one of you to come together and like dump all your insecurities there and everything. So I started making tote bags at that time, but that tote bag was actually a platform for me to start inspiring people through my entrepreneurship, through my business lah. So instead of it being a business that is very centered, very business centered, I wanted it to be a brand that is very community centered. So yeah, but I couldn't do it because I was having my full-time job and I cannot really pursue that full time. I cannot really do much things about that. I cannot really be in touch with a lot of people because of that. So so that's why I resigned and I started to want to pursue more of my business and also digital creation so that I can be more in touch with people without any deadline timeline. Last time I got this job, I got tomorrow I got morning shift, I cannot do this. Yeah, I don't have that anymore. Time is not is on my side now. Yeah, so yeah, that is the reason why I started my business.
Thank you, Tracy.
Mm.
Okay, so there are also a few questions.
Mm.
Does the work environment in Singapore toxic? So how do you cope with the colleagues' toxicity?
Okay.
Yeah.
Okay. What to say? Does the working environment in Singapore toxic? Anyone is more anyone who is like a nurse more than 10 years would tell you this. Every working environment is toxic, not just Singapore. I guess because we are nurses, we work in a very fast-paced settings. And I'm not saying my working environment before was toxic, but you will struggle because in Singapore, you are considered a foreigner, okay? You are not their citizen. So you gotta earn You have to earn the place there. You're gonna face a lot of like, my salary is lower than Singaporean level. Why? Yeah, Singaporeans. But yeah, but there are Singaporean colleagues that are nice. Some are not that nice lah. But I'm gonna tell you one thing. When I worked in Malaysia, when I was a fresh grad in ICU, I cried more than I was in Singapore. Yeah, because in Singapore, even though they are top, even though they treat you like strict, but they will guide you and they will not like let you take the cases alone. You get what I mean? When I was in Malaysia, on my first day of working, I was a fresh grad ICU nurse. I straight away take cases, and I don't even know what case. Like I didn't even study anything about ICU last time. But when I was in Singapore, they place you in a probation phases so that you can like, you cannot be alone lah. You cannot be alone to take care of patients. You must have someone to guide you. So I guess it all comes to your strength, your mental strength to endure all of it. Because when you work in nursing, it's a very fast-paced, fast-paced environment. You're expected to save life. You cannot expect much of, okay, one patient collapsed, right? And you're like, oh, I don't know what to do. I'm new. I don't know what to do. You cannot be like that. Even though you're new, go there and save that patient. That's someone's life. Okay. So it all comes down to whether or not you're strong enough to endure all of that lah. Yeah, toxic or non-toxic. Just be strong to endure everything. Yeah. When you become a senior, you're gonna think like, actually nothing like that lah. You're like that. Yeah, but eventually you get used to it lah. That's what I can say. How to cope with colleagues toxicity, is it? Don't care about them. They don't pay your salary. Just have this mindset like, who are you? You know, unless she's your preceptor lah, just keep past her a bit lah. Try to be friend with your preceptor. Try to be friend with your preceptor and your manager. But then if your manager don't want to be friends with you, don't force her lah. Just like be respectful. Or one tip, if you're new in the department, always answer call bells. Do not let the call bells hanging like that. Just answer it. Even though you don't know what to do, just answer it. They like seniors like that. Okay. Because I like that. Okay. Next question.
Okay, thank you. So questions. How do you cope with loneliness when you're living alone or when you're going through university? How do you cope with loneliness?
Do I look lonely? Okay. How do I get with loneliness? To be honest, you're gonna feel lonely even if you got a lot of people with you. Just kidding. Actually, yeah, like I'm pretty sure like you as a student, if you don't come from Kuching, is Unimas in Kuching? Yeah. In Kuching, I think if you have family here, maybe, I don't know if you feel lonely, but if you're someone from outside of Kuching, you're gonna feel lonely. Let me tell you, when you go to work, you're gonna feel even lonelier. So what I suggest you to do is when you're a student, you're lonely, right? But you don't have money. When you're working, you're lonely, but you have money. Go travel. Go travel. Go do something. Go find a hobby. Okay, that's what I did. In all my years, I do feel lonely, but it's not like a terrible lonely lah. Like, yes, I am lonely because I really want to see my family. At that time, I don't have a boyfriend also. So I was really like lonely, like damn lonely. I always like, and like for me, I'm very introverted. Extroverts don't really feel lonely actually because they can be friends with everyone. But for me, I'm introvert. I cannot be friends with just anyone. My social battery dies down very easily. So for me, I am prone to loneliness. But I like to do things myself. I like to go out to eat alone. I like to, actually, I find being lonely is better because when I was a student, I was lonely, and that's where I keep on studying. Because if I study, I don't care about anyone else, that kind of thing. So yeah, I keep on studying. I really love studying actually. Yeah. And then at the end of the day, my loneliness got me a distinction, got me a 4.0 CGPA, and yeah, it got me a scholarship. So yeah, don't treat your loneliness as like something bad. Think of it like something you can enjoy. Okay, like me now, I got married, right? I do not have a single time to be lonely now. Okay, after I got married, my husband is the type to talk, talk, talk. So like I cannot be lonely anymore. So I really appreciate my early 20s where I was so alone, where I have my peace and quiet. Okay, so just appreciate your loneliness. Don't think of it as something bad. To be honest, I cope with it by traveling a lot. I travel a lot during my times when I was young. And then I have a lot of hobbies. That's why I got into my business now, because I got a lot of hobbies last time. I used to play around with designing things, sewing, yeah, a lot of things. So yeah, have a hobby, travel a lot. Don't think of loneliness as a bad thing. Okay. That's it.
Okay, thank you. So there's someone says, talking about boyfriend, someone says, can I get a boyfriend even though I'm busy with works later? Because my high school teacher once said you will get a boyfriend in college soon, but now sadly no.
No boyfriend?
Yeah.
Okay. Girl. Uh, how do I answer this? Actually, oh shit. I'm so sorry. Somebody called me. So yeah. Can anyone hear me? Can see me? Okay. No boyfriend actually is a very good thing. No need to have. Be honest, I went through college without boyfriend. I went through uni without boyfriend. Because I don't think having a boyfriend is an important thing. But because if you think logically, when you're in university, you don't have money. Like I did work part-time, I got money, but only enough for myself. So that if I have a boyfriend, I have to spend money with him as well because he also got no money. For me, like there's no reason for you to have a boyfriend now. I think it's better to have a boyfriend when you're in your working phase. That's when you can have a lot of boyfriends. You you don't need to have one boyfriend. You can have 2, 3 boyfriends also when you're like when you're working around because you have money. When you have money, it's nice to go dating. It's nice to go here, go there. And like you said, do you have time to date when you're working? You got time one, sure. In the hospital, you can choose pick one person. A lot of doctors. Now got social medias. I met my husband through TikTok. It's not impossible to get a boyfriend when you're working. Don't compare yourself to other people. For me, when I was in university, all I did was I focused on studying only. I'm a very, if you see me in university last time, right? I was one of the students that you cannot really see go out. You didn't really see me going out because I was always stuck in my room. I was stuck in my room. I was stuck like studying. Eh, I don't know if you guys going to believe this, but every night before I sleep, I will always read one chapter of what I study. I think I was a very big nerd at that time. I didn't have time to date. I didn't have time to look at guys also. I didn't have time, blah, 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 blah. I didn't have time to date. Maybe I had a few opportunities, but I didn't want to. But yeah. So for me, I think boyfriend is the least of your worries, boyfriend or girlfriends. When you're working, can lah, can whatever you want to do. When you're studying, I don't think that's necessary. Unless you have a boyfriend now, it's okay lah. Yeah, it's okay. But yeah, but if you don't have a boyfriend now, do not feel like you're late because in your working time, You can have 10 boyfriends if you want. So yeah, don't worry about it. Does that answer your question?
Okay, last question
Last question
from,
already.
so you seem really happy right now after you quit your job, and she's really glad that you're enjoying your life to the fullest. But in the nearest future, will you be working again as a nurse?
Hmm. I thought a lot about it. I've seen a lot of this question as well. Be honest, I do want to work as a nurse again, but not in bedside. So yeah, not because bedside is hard, struggle a lot in bedside nursing. I actually really do miss working in bedside. Wait, this I actually do really miss working bedside. I miss the smell of the hospital. I miss my patients. I miss my colleagues. But too much of everything going to swallow you, you know. I was in bedside for almost 10 years. I was really happy when I get to teach students, but that's it. You know, after teaching students for 2 weeks, I'm back to my bedside roles. I'm back to my administrative roles. I'm back to this, to that. And sometimes it doesn't feel like slowly your patient is going to burn. Like for now, when you're a student, you feel very, I want to be like Daisy Pan. I want to go Singapore. I want to work there. Oh my God. Like I cannot wait to work, something like that. You have that patience. But believe me, in five to when you're like me, when I'm in my 10th year, I feel so burnt out because I've been doing like the same thing all over again. Maybe some nurses, if you ask another nurse, they can tell you, "Oh, I love working bedside. I think I'm gonna do this for the rest of my life." But for me, I don't feel like doing it for the rest of my life. So that's why I'm trying to find, not trying to find. I'm already in a job in a work scope where I am also a nurse, but not practicing bedside. Like right now, I'm talking to student nurses. Uh, I'm I'm going to give another talk for another university about nursing, those kind of things. And I like making videos about being a nurse, this one, that one, answering your questions. So starting my own business because I don't know if I should tell you this, but I'm actually currently in a project where we're going to do something about nursing, like a digital book where students can refer to. Yeah, something like that. So I'm still in the process of doing that. So I did not completely abandon my nursing job yet. I'm still in the nursing world, but I just don't practice bedside anymore. So answering the question whether I go back to work, I'm already working right now. I don't need to go back to work. But I am working right now, but it's not a bedside work. So yeah. Um Thank you for realizing that I look happy. Yes, I am happy. Because I do not have to wake up for a morning shift anymore, or I did not have to sleep like for night shift. Yeah, but I do miss bedside. Okay, I'm not demotivating you guys not to go to bedside. Go to bedside first. You learn a lot, but yeah, that's what I'm feeling after 10 years. So yeah.
Okay, thank you.
Yeah.
So opening questions to the floor now.
Oh, okay.
Yeah.
Okay, if you want to ask questions, you can ask now because yeah, if you DM me and ask question, I don't know if I'm going to reply. So I don't look at my DM so often. By the way, is this a final year project?
Yes.
Oh, okay.
Yes, it
I
is.
hope you guys get good marks. Yeah. Last time I used to have this kind of project when I was a student, but we held it like in an auditorium. Miss that. I heard there's another conference in Unimas. But yeah, I thought it was that conference. I was so nervous. Luckily, it's just this webinar. Any questions?
Any more questions from the floor?
Well, I saw this question, right? What if I don't want to be clinical nurse? Is there any job but still called as nurse? Yes. Like I said, offshore nurse, aesthetic nurse. You know aesthetic nurse? The one that do Botox and stuff. If you like beauty, you can be that nurse. My friend's an aesthetic nurse. She's so rich. Aesthetic nurse is very rich because you're in a private clinic, right? So the doctor can pay you so much. Yeah. And like if you're an aesthetic nurse, you get this like treatment for free for your face. Yeah. So you're pretty and rich. If you want to be an aesthetic nurse, I recommend you to go. Okay.
I guess there's no question from the floor. I think we can end this webinar.
So I think before we end, we would like to promote our own conference for the Unimas because yeah, it's coming soon for the 3rd and 4th May of this year. So it'll be held at Unimas itself at our Delta, yeah, our day one. So we would like to invite everyone here if you are free to join. Yeah, because there's also CPD points for currently working nurses, and also because it's currently for this time we're doing it international, so it will be a great opportunity to build a marketing channel for everyone. So we hope to see you there. So before we end, I would like to ask everyone to open their cameras or anything because we're going to have a quick photo session, if that's okay.
Apa kamu tunjuk Telegram dulu?
Yeah, we're gonna wait for people to open their cameras. Yeah. Okay. Okay, 1, 2, 3. Okay. Oh wait, another one. Okay. One, two, three. Okay, and last one. Okay. 1, 2, 3. Okay, yeah. Thanks everyone.
Thank you.
Thank you, Tracy.
You're welcome. Where's Azamul? Where's Azamul? by the way?
I'm here, Mr. C.
Oh, that's you. Thank you so
Yeah.
much for waiting for my WhatsApp. I'm Sorry, I always reply
It's
late.
okay. Oh, by the way, Miss Tracy, can we ask you for your permission to upload the recording of this? Because I guess there's a lot of people who want to come, but I think the Zoom meeting is limiting to 100 participants just now.
Okay, can. No worries.
Thank you, Miss.
Okay, bye. See you guys again.
Thank you.
And if